Hi, my name is Rahema. I'm doing my presentation on group therapy. Group therapy is a type of psychotherapy. So, about group therapy is a unique specialty form of psychotherapy where one or more therapists leads a group that consists of 5 to 15 patients. Group therapy is viewed as a promising treatment that is practiced in clinical settings for patients who suffer from mental health issues or emotional problems. Um, So the group would meet for at least an hour or two every week. Group therapy comes in many different forms, and each kind provides its own insight into the group dynamics where the therapist is guided to effectively intervene. Interpersonal group therapy is one of the forms of group therapy, and this type of group therapy is based on Harry Stack Sullivan's work. And this approach focuses on the patient's preference on building secure relationships because the patient they maintain parataxic distortions where their perceptions of reality are based on the realities they have experienced in their past. And the level of confidence of the therapist is crucial in this type of group therapy because it affects the function of the overall group, especially in the initial group sessions. And the therapist's role is to encourage unity within the group and create a supportive environment where the parataxic distortions can be explored. So here are other forms of group therapy. They are psychodynamic group therapy, psychoeducation, and cognitive behavioral therapy. So psychodynamic group therapy is an approach that was developed by Wilfred Bion, and this approach centers on helping the patients gain self-insights and hold the principle that all of their thoughts and behaviors are originated from pre-conscious and conscious processes. And in psychoeducation combines the elements of group therapy, cognitive behavior therapy, and education to provide family and the patient with certain components of information regarding the illness of the patient and its treatment. So the treatment of the illness. And psychoeducation is meant to prevent relapse and engage the patient and the family in crisis management and suicide prevention. Also, mental health professionals and family and the patient can work together towards creating positive overall outcome for the patient. Cognitive behavioral therapy is another form of group therapy, and it was developed by Aaron and Judith Beck. Cognitive behavioral therapy emphasizes the importance of collaborating to understand and describe the relationship between human behavior, thoughts, and emotions. So the origin of group therapy. Group therapy was developed by Joseph Hersey Pratt in 1905 in Greater Boston. He started his work with a group of 8 patients. Um, these patients that he worked with were fighting pulmonary tuberculosis. And as he was working with the patients in the group, he noticed how impactful the experience was. So after noticing how impacting the experience was on the patient's emotional well-being, as he was leading just a general care instruction classes, he began having the patients. So he started having the patients to discuss their common problems. So he went from there. So after he began having the patients discuss their common problems, Then he observed them, and from his observations from the group therapy sessions, Pratt reported that he noticed positive outcomes from this new type of treatment that emerged from his regular classes. And so after that positive incident, um, so and then group therapy became more popular. So historically, the very first formally organized therapy was Joseph Hersey's group therapy session that emerged just from his regular classes that he was holding. And then in 1936, group therapy intervention was practiced. So with therapy, group intervention was practiced with discharged patients from psychiatric hospitals and inmates in prison because of how beneficial they have found group therapy to be. And the purpose of group therapy is to treat specific conditions that the patients may have in common, such as social anxiety, depression, manic disorders, substance abuse, chronic pain, anger, and many more others. Other conditions include trauma, post-traumatic stress disorder, ADHD, or attention deficit hyperactivity disorder. Many people experience difficulties with mental health, and only a few people seek help to speak openly in front of a group of people they just met. Another purpose of group therapy is to help the group members to enhance their social functioning through the group experiences and to utilize coping skills to effectively cope with their personal or group problems. The purpose of therapists leading the group is to hopefully bring change into the lives of the members of the group. Some more benefits of group therapy. So even though the patients who attend group therapy together for the very first time are strangers to each other, there are many benefits of attending group therapy. So as the patients continue to attend sessions together, they share, they connect, they get to know each other more, and they act as a support system or support network and sounding boards to one another. Group members can help each other by coming up with ideas of how to get through difficult situations or tough life challenges. And attending regular sessions and listening to other group members can help participants to bring their own problems to perspective. And hearing group members share the problems that they are struggling with can bring relief to other members in the group. Groups are more beneficial when all the members share similar difficulties and similar functioning levels. Uh, so diversity in the group can be another benefit of group therapy. Individuals with differing backgrounds and different personalities look at situations differently. So when group members hear and learn how other members would solve problems that they encounter and develop positive changes, they themselves discover many strategies of facing their own problems as well. And the therapists leading the group teach the group members strategies that can be used to manage problems that patients may may be experiencing. Also, a therapist leading an anger management group will share with the group scientifically tested and proven strategies that can be used to control anger. So there are closed and open group therapies. An open group therapy session allows new members to join in at any time um, during the sessions, and there are adjustment periods where the members are getting in the group are getting to know each other. And a closed group therapy will only allow members who started the group together to stay in the group. And if a new member was wanting to join, they cannot join. They must wait. And for the sessions to end, it may take up to 12 sessions. And yeah, and those who are waiting to join the group must wait for all the sessions to finish, which can take up to several months. So groups come in different sizes. As mentioned at the beginning of the PowerPoint, they come from sizes of 5 patients to 15 patients. So here, a smaller therapy group can offer extra time to focus on each individual in the group. So, for example, at my internship, I have observed that smaller groups can offer a more intimate setting or a more intimate environment where members connect better and are more engaged, and the group members are more likely to share because of that small circle. And larger therapy groups would offer more diversity and more perspectives because there's more people in the group. And uh, I have observed connections among group members occurring in larger groups, but people are least likely to share in larger groups. Thus, yeah. And here you have the procedures and guidelines of a group therapy. So every group may have their own procedures and guidelines that all members have to follow and have to agree to. Um, these are examples of procedures and guidelines that may be present in a group. Confidentiality is one of them. So confidentiality in a group means that anything that occurs and anything that is said in the group among group members stays in the group and cannot leave the group. The only exception to this rule is that the group leader is obligated to make a report if they believe that someone in the group plans on harming themselves or harming others. Privacy is another rule. Privacy is also known as the stop rule. So, privacy in the group means that group members are not required to share or answer any questions that they do not feel comfortable answering. They're also not required to participate in any activities they don't wish to participate in. And so no one will ever be pressured to participate or answer anything they do not wish to. And it is the responsibility of the group leader to enforce and protect this right. Dignity is another one. Dignity means destructive behavior is not allowed, and no member of the group will ever get humiliated, abused, or hazed in any way. Violence and intimidation. Violence or any intimidation in the group is not tolerated. Any group member who threatens anyone or the property will be asked to leave the group. So here we have more procedures and guidelines. The first one is about alcohol and other drugs. So within the group, any group member who is under the influence of any alcoholic beverages or other drugs that alters their mind will not be allowed to join the group. And also exclusive relationships is another one. Exclusive relationships with other members in the group are not allowed because this kind of the breakup when they suppose two group members are dating. When they break up, that may have an effect on the group member or members who continue to attend group as it pertains to them continuing to attend the group therapy. So when a member is heavily affected by the breakup, they may choose not to show up to the group session. So due to that reason, they're not permitted to have exclusive relationships with other members in the group. And gossiping. Gossiping and holding secret grudges towards other group members in the group is considered to be a very destructive behavior. Therefore, it is not tolerated. And those who have things to say to others, to other members, are encouraged to say it directly to them during the group sessions. Attendance. Attendance is very important. Group members are expected to attend every scheduled meeting, and if an emergency were to occur, the group leader has to be notified as soon as possible. So responsibilities. The group leader or the therapist is responsible to enforce all of the procedures and guidelines in the group, and the group may propose procedures and guidelines that they come up with. Termination. If a group member in the group decides to leave the group unexpectedly, they should take responsibility in announcing it at the beginning of their last meeting so that other members of the group have time to ask questions. The purpose of this is to so that other members who are remaining in the group, so they don't feel like they may have said something offensive that may have caused the other member to leave. So that's why they have to notify the group when they are leaving. That's why that individual that plans to leave has to notify the group that they're leaving so that members can ask questions. And all members of the group, including the group leader, must respect the decision of the individual who wants to leave the group. So even though things that are shared during group sessions are confidential, there is no guarantee that absolute privacy will happen. And all members should use common sense when sharing their personal information. Open and honest communication between group members can be expected in group settings. So, application to a client. Applying group therapy to a client, a specific client. So on Thursday, July 18th, I joined a group session at Ocean's inpatient program. And the topic in the group session for that specific session was sachet check-in. So before the group started, the facilitator and I passed out handouts to every patient in the program, in the inpatient unit, and invited them to join us, to join the group. When those who wanted to join came into the TV room, that's where the group therapy was being held. After everybody gathered in there, the facilitator thanked them for joining the group, and I counted that there were 15 members in the group. So yes, that is the maximum numbers that can be in a group, from 5 to 15. So the facilitator discussed the procedures to the group. Then he introduced the topic of the day. He then explained the process of the activity. So in sachet check-in, there are 6 emotions, which are sad, angry, scared, happy, excited, and tender. The individuals in the group who were feeling all 6 emotions could say that they are feeling full sachet instead of listing all of the 6 emotions that they were feeling. And when checking in, group members, they have to start off by saying, I'm checking in. And when they're done checking in and giving the context behind why they feel the way they do, they check out by saying, and with that, I'm checked in. And after they say, after the person who just got done sharing says, with that, I'm checked in, everyone in the group or all group members, they have to validate that person by saying, heard, all together. So before beginning the activity, the facilitator asked the participants to participate in an exercise to activate their relaxation response. They were not required, but they were encouraged because it helps them to feel relaxed. So they were asked to take deep breaths, breathing in through their nose and breathing out. So they would breathe in, pause, and then breathe out. So after that deep breathing exercise, exercise, the facilitator explained to the group that. So the facilitator explained to the group that check-in can help them boost communication skills with their friends. He also mentioned that he highly encouraged everyone to check in. And check-ins cannot be forced. If an individual doesn't feel like sharing, they can just say pass. The facilitator reminded the group that tears are welcomed, and whoever feels like crying, they should just let them out because it's a part of the healing process, and that the group is a safe place for that. So he also stated that to ensure to respect everyone's time during their checking, we must show support and respect by letting them finish their talk or finish sharing without interrupting them. So to demonstrate for the group, the facilitator checked in first, and afterwards, the first member to check in checked in as she said, I'm checking in as excited, sad, and angry and scared. She said that she was excited because she will be going home to spend time with her children. She was sad because she was not sure if she would be able to get into rehab, and she was angry for placing herself in the position that she's in, and she was scared because she was fearful of what is going to happen to her. And when she was done checking in, she said, and with that, I'm checked in. So everyone in the group said, heard, in union to support her for being vulnerable and validate her emotions. When the group session came to an end, the facilitator thanked everyone for joining the group, and he appreciated them for being there and encouraged those who didn't participate to participate next time because it's a safe place to share. In conclusion, group therapy is a critical, unique form of psychotherapy that is practiced in mental health hospitals. Group therapy was initially started at the beginning of the 1900s, 1905. So, just 1905 by Joseph Hersey Pratt. And when it came to the emotional well-being of patients, Pratt reported to have noticed positive results from group therapy, and therefore this type of psychotherapy is successful until today. Group therapy is being used at the facility where I'm at. Today, there are many types of group therapy, including psychodynamic, group, psychoeducation, and cognitive behavioral therapy. I have noticed that at Oceans, group therapy is used simultaneously with medication to treat patients. From observing group therapy and facilitating it, I have noticed that patients really love it. And patients at both inpatient and outpatient programs at Oceans are very engaged and eager to share during every group session. So on a normal day when I do attend group, there's always one patient who would walk up to me and ask me, when is group? When is group starting? Because they're so excited to go. They're so excited to join the group. So that was my presentation. Thank you so much for watching and listening. So these are the references that I have used throughout the PowerPoint.